Would you consider yourself to be an animal empath? If so, this episode is for you. Welcome to the Sensitivity Doctor, where we explore everything about sensitivity, neurodiversity, and all the things in between. My name's Dr. Amelia Kelley, and I cannot wait to unpack this episode with you. I got to speak to Dr. Kelly Fishman from Strut Animal Hospital. At that place, they do some of the coolest stuff, like dog push-ups. Yes, you heard that right. We talk about what is it like when you start to experience as an empath, or really just any deep-feeling person who loves your pet's midlife crisis. Yep, midlife crisis. I hadn't heard the term before either. We talk all about what it looks like, what to do when it happens, and how you can make sure that you and your pet enjoy all the years together. I literally walked away with so many good pointers that I'm going to run out and do immediately for my own dog, and also just a way to really validate how high sensitivity can show up in our relationships with them. And we even teased a little bit about highly sensitive animals that I will definitely have to get back together with her to talk about. She is so knowledgeable, such a rock star, totally thinks outside the box for all of your fur babies. I hope you enjoy the episode. I'm super excited for you to be here. I was saying that when your team reached out about the topic we're going to talk about today, I had never heard about it, so I'm excited to dive in. But before we do that, can you tell listeners a little bit about you and your passion?
Yeah. So I'm not a normal veterinarian that does vaccines and general practice. So I'm in an area of veterinary medicine, which is all about the physical body and how it feels and how it moves. So, for example, I help dogs recovering from surgery, but I also help a lot of older dogs that are slowing down and are painful, and I help them maintain strength as they transition into their senior years. And then I also, and I do that with a combination of exercises like dog push-ups and
Wait, what?
yes,
Did
for
you just
front end
say dog
strength.
push-ups? Okay, you're
That's
killing me.
right.
I want to know exactly
Yes.
what you're talking about when you said dog
So
push-ups.
when we think of building strength in a dog, I can think about the same way we build in strength in a person. So for example, if a dog is weak in its front legs because of elbow arthritis, for example, I'll show the pet parent how to do a dog push-up to strengthen the front body. But we also have things like dog crunches and,
What?
dog squats. Yeah, it's really cool. So every exercise to target every muscle that you have for a person, we have in the veterinary world to help our dogs maintain strength and maintain muscle condition, which is as important, for them as it is for us. And then I have a whole host of pain management tools that aren't just pharmaceuticals. So, for example, cold laser that helps reduce pain. I'm an acupuncturist,
That's cool.
chiropractic, massage, heat, ice, myofascial release, PEMF. We have things. A PEMF is so it's a pulsed electromagnetic field that manages pain in animals. And actually, there's a company that's shown that it actually benefits dogs with anxiety. So you could put
Oh,
it on their, like a little, Assisi Loop is the name of the company, but you could put it over their little dog head and it helps relieve anxiety as well.
oh.
So,
It's
yeah, so
not like
all,
it's not like neurofeedback, is it?
no, it's not. It's
Oh, okay.
basically it's a magnetic current. So a
Oh, like
little
TMS then, kind of.
I'm not sure what TMS is, but if that is, if that is basically a magnetic field, then yes.
Yeah, transmagnetic stimulation. It's kind of like
Okay.
a lesser, way less intense version of what we used to call shock therapy, where
Oh,
you
okay.
can target certain areas of the brain and stimulate activity, but through magnetic currents. It's
Oh, interesting.
FDA approved for humans.
Right.
So it
Yeah,
sounds like what you're talking about is something for dogs
for
and
dogs.
animals and our
That's right.
pets.
Yes.
My mind is blown that you just push-ups and crunches. I'm like, where were you 10 years ago or however many years ago? I had a dog that had, he was a pit lab mix, and they tend to have weird hip, knee stuff,
Yeah.
especially if they're energetic. He had to get not one, but two knee surgeries. I didn't know anything about. any of that.
I know. And and a lot of people don't, which is part of the reason I am here now with you, Amelia, because people don't understand that this is an area of veterinary medicine, that there are tools and resources and
Yeah,
supplements and nutrition. There's so much out there. Like you can find most people can find a rehab specialist in their area, in their state and in their city. And, we're accessible now and people should know about it because it is a really wonderful area of veterinary medicine and we have so
right.
much to offer.
I love that so much because my special interest in this today too was that a lot of highly sensitive people, which make up a lot of the folks that listen to this podcast, are very empathetic towards their animals. Many, even some will even call themselves like an animal empath, or that they really struggle when their animal is struggling. And so many times I've heard people say, if only my animal could tell me what's going on, I feel like I could do something.
Yeah.
So I was mentioning when your team reached out, there was a term I'd never heard before in reference to animals that I think we shouldn't wait any longer and just dig right into it. And then I have so many other questions for you. But the idea that animals experience, much like we do, a midlife. And so I'm curious if you could unpack, what does midlife in animals, I almost have to keep myself from saying crisis. Maybe it is a crisis. I don't know. What does midlife in animals look like? And maybe what are some of the early signs that pet owners might want to notice? Or maybe it's not even signs, maybe it's age. I don't know.
Yeah. So part of what we want to talk about midlife in our dogs and our cats, so it happens to both of them, is because there's so much emphasis on puppy care. And people come, they get a dog, and they're always at a vet when it's a puppy. And then about 2 years old, they stop going to the vet regularly. Everything's good. And then what happens is the dog all of a sudden is 13 years old. They can't get up the stairs. They're having a hard time, jumping in and out of the car. They're slipping and they're sliding on the stair, on the floors.
Yeah.
If it's a cat, maybe they're not using the litter box, and it's nothing to do with, the vets rolled out everything medically and they're like, I don't know why, but the cat's not using the litter box anymore, which is a huge problem for the cat. It's
Right.
distressing and for the human. And so what we're trying to do is say, hey, there's this time that's midlife, right about the human equivalent of 50 years old, when things are starting to break.
Well, I was trying to,
break
that was me
down.
doing the math for my animal as well.
Yeah. And I'll break it down exactly because we have to think about cats differently than dogs when they reach midlife, and then about big dogs versus small. So I'll talk a little bit about that too. But what does this midlife mean? Why is it important? Because it's an opportunity for pet parents to know that their life is about to change as they become a senior. And as they become a senior, knowing that, their metabolism is changing. They are losing muscle and they're losing strength, in addition to normal aging changes like sight and hearing changes as well.
I'm
So
sorry,
it's a
I'm smiling because my dog is on the mat in here and he's
yeah.
dreaming, and I can see
Uh-huh.
he's a huge dog. And so it's hard to
Yeah.
miss. His little legs are going.
So you said he's a Weimaraner, and how old is your dog?
Well, so he's a Weimaraner hound mix, plot hound mix. So he
Okay.
doesn't have that kind of silver gray to him.
Yeah.
But he's got that structure of a Weimaraner and the ears and everything. So he's 7.
Okay.
And it's funny because in some ways people think he's older than he is because he went gray super young. But physically, he seemed so much more resilient at this age than I would say my love of my life dog, because it was the dog I had before I had kids.
Yeah.
That dog passed at 9.5 from Cushing syndrome,
I see. Yeah.
which was terribly heartbreaking, because it was way younger than we expected. So I notice, at least now, he still seems pretty good, but I'm definitely noticing he's not quite as hyperactive. The two together, that those breeds together are wild.
So is he over 50 pounds or under 50
Oh, he's
pounds?
over.
Okay. So a dog like him who's over 15 pounds is going to hit midlife now at 7 years old. So
Yeah.
he's just hit midlife. And so, like I said, his metabolism is slowing down. He's losing muscle. He's losing strength. You may notice that in small, subtle differences or subtle changes, like not wanting to play as much, not wanting to have as much what we call stamina, which is the strength and motivation to go on long walks and to do things that they love. So, also some things that start to change are they withdraw a little bit from the pack a bit. They seem a little bit, like I said, less playful, less willing to go on walks, those sorts of things. And so your dog is definitely midlife. Yeah.
No, I can see that. It's interesting because living in North Carolina, I feel like no dogs are motivated right now to play because it's hot as all get out. But um, it's tricky with him too because we're having a whole session about my dog. He, as far as I can tell, kind of has like a hyperactive, kind of more ADHD brain.
Hmm.
Our vet that we work with is amazing. She's very think outside the box. And I had told her the symptoms I noticed very early on for him. And she's like, yeah, we don't medicate ADHD in dogs. But it also translated into more anxiety. And
Yeah.
so he's been on Prozac for years now for
Yeah.
his anxiety.
Yeah.
I almost feel like intuitively, as we're talking about this, that because he's hit midlife and because he's probably just slowing down in general, that maybe we could dial back and not do the medication anymore and do something else.
Well, I mean, certainly with Prozac, it's something in an anxiety disorder because in dogs, it's a behavioral issue, right? And it's always possible that if circumstances change, you could always taper them off the Prozac, which you do very slowly with the guidance of your
Of course,
veterinarian,
yeah.
right? So, and then at the same time, what you could be doing is doing some behavioral changes, for example, that will help alleviate, kind of like redirect the anxiety. So I always recommend like nose work is a great thing. So that's actually
Nose
when the
work?
dog, yeah. So dogs, we in the veterinary medicine, sports medicine, and rehab area, we think a lot about nose work because we deal with dogs that are working dogs. And working dogs are the ones that do search and rescue, the bomb detection and drug detection and people detection dogs. So what those dogs are doing is technically called nose work, where they've been trained and selected to actually search out different scents and kind of like stay with them. And then it actually is a great way to like burn calories and burn energy. It's a great, thing for them. Or do exercises with your dog. I would tell you, if dogs get bored of just doing walks, and walks are
Right.
not enough physically to really get out the energy of a dog like yours, like with the breeds that, especially the Weimaraner part, like a walk for, it's not going to do anything.
I still remember years ago when I had picked him up from the pet, like whatever pet boarding place. And I'd asked him because he had a really vivacious day. And I was like, so when is it that Weimaraners kind of, mellow out a little? And the lady laughed at me.
Yeah.
She's like, give it 5 or 6 years. And I was thinking, really?
Yeah.
She
No, I
wasn't
know.
wrong. She wasn't wrong.
Yeah. So yeah, so that's kind of what the midlife crisis is. And then to just touch back on like the difference between our bigger and smaller dogs is our dogs are under 50 pounds. So not your dog, but like a Frenchie, Chihuahua, they hit midlife later. And because they're aging at different rates than our bigger dogs, and they're going to hit midlife at 10. And that's similar to like when a kitty hits midlife. So our smaller, yeah, like our little kitties, which I never want to forget about being a cat person myself, is that our kitties are also having a midlife crisis too.
So the signs that I'm hearing you say are things like slowing down, seeming like you have less stamina, maybe retreating a little bit from the pack a bit and not feeling the need to be as kind of in the middle of everything. Is there anything else?
That's it. I mean, aside from, some of the other things like that are not visible, like the muscle loss, like the changes in their metabolism, like the changes in some of their, digestion. It's a little bit harder for them to digest. But this is where I love my animal empaths because people who are in tune with their animals and they're the ones to see stuff that we don't see as a veterinarian because your dog comes in to us, you have 15 minutes with your vet. there's, it's a kind of a chaotic situation with their dogs and people. The hospital smells like fear and sickness. So the dog and the cat, especially our kitties, go into almost like a kind of state where they hide a lot of the pain. So
Oh, interesting.
my animal empaths come into me and they're like, there's something wrong with your dog or with my dog. And I don't know what it is, but there's something wrong. And maybe it's a little bit of a hitch that I see sometimes when they're kind of running weird. And of course I bring him to the vet now and no one and the exam's perfectly normal. Or like they sometimes yelp or they seem like they're grimacing or their eyes are wider or something's just weird. And it's so important for your animal empaths to know that what they're picking up on is true and probably something that's wrong. And to really bring that kind of those things, like if I heard any of my pet parents say that to me during an exam, even if my veterinary exam was totally normal, I would be like, hey, those are all big red flags for pain that my pet parent sees because they are 24/7 with their dog or their cat. They're 100% in tune with them, even more so than maybe the normal person. And I need to listen to that.
It's interesting because what you're saying is almost making me think of something that could potentially happen, not in an ideal situation. When I think about the term medical gaslighting
Yes.
and the potential for someone who is an empath to have such strong senses or feelings about how their animal is doing, and then they bring their animal in, and then maybe the vet is, I don't know, understandably burnt out because it's a hard field, or maybe they haven't done extra training, or they just are having a bad day. Like how would you recommend someone who is feeling deeply for their animal's well-being to handle feeling like your concerns are being, because medical gaslighting includes being minimized, questioned, maybe even making you feel like your concerns are crazy or off base. How would you recommend someone handle that?
Yeah, I mean, it's hard because you have to have the right veterinary team. And I would say, trying to find someone that pays it, like really does listen to you is, important. And you can find those veterinarians out there. I would also say, as a vet, bring in video, like bring in evidence. That's
Oh,
very
okay.
helpful.
It's a good idea.
Record stuff. If you and like grimacing and having like weird, behaviors, like that's not normal. And if you can show your veterinarian a video of some of that stuff, like that's like just really helpful actually as a vet to have that sort of thing. Especially with pain, because pain in animals, we know, cats especially because they are a predator but also a prey species, hide their pain. They hide it
Oh,
from
I did
you.
not know that.
They
I'm allergic to
very much.
cats.
But kitties hide their pain, and then our dogs with a high drive hide their pain too. And high drive dogs are like a Weimaraner, a Lab, a German Shepherd. Dogs that, like, what will happen is they'll go out and they see a ball or they see their favorite human or they want to keep, going for their walk, and they're gonna just go through pain and overexert themselves because they have that drive to do whatever it is that they're doing. So it is really good when you have, even when you're an animal empath and you know that your dog is pushing themselves. You know what I
Right.
mean? Trust yourself. I would say trust
Right.
them, trust yourself.
I love that advice. It really aligns completely with what I've told humans to do. Not necessarily, we don't really need to record ourselves because we have our voice and we have journals and we have things we can write. We can go and hopefully speak for ourselves. But because our puppy is not going to just randomly pick up a pen and journal their symptoms, it makes a lot of sense that what you're saying is like bring in some evidence and bring in
Yeah.
something that shows and expresses what's happening. That's wonderful advice. And
Yeah.
what were you going to say?
Oh, no, also if anyone does want like a little bit of guidance, you can Google pain scores in dogs and cats. So if you're particularly
Oh,
concerned about pain, there
okay.
are visual pain scores, which means that you could look up in Google, what does a grimace or a pain sign in the kitty look like? what are some of the pain signs in dogs? And they're made for pet parents to kind of make observations at home and trust their intuition and write that down. So if anyone out there does have, because I think that my number one question I always get is my dog in pain? Is my cat in pain? Because that's a quality of life issue.
Right.
You could be a paralyzed dog and we put you in a cart and you have a very dedicated pet parent who cares for you. You could have a senior dog that's limping. We could, manage some of the mobility. We can build strength using supplements. We could build strength using exercises and things like that. But like if a dog's in pain and we cannot address that, that's something that no one wants. And so I think that if people do have a concern, know that you can, Google these pain scores and find them easily online.
And do they only have them? That is really interesting, and I love that advice. So far, we have dog push-ups and pain scores. Is that, you said dogs and cats? Do they also have, I randomly have a couple clients with rabbits. I think a lot of people feel very
yeah.
connected to rabbits. Is there also a way
Yes.
to tell that in them as well?
Yes. Yeah, I think so. I haven't worked with rabbits as much personally, but I would imagine that there are. Yeah, they're great.
I actually have a client that brings a bunny into her sessions.
Oh, cool.
Yeah, I've told people if you have well-mannered dogs who don't bark and are housebroken, they're welcome to come in. But like I said, I'm allergic to cats, so no cats. I don't know how much a cat would want to sit in my office, though. I'd just be trying to get out to my bird feeder the whole time.
Probably.
So I'm curious, I'm thinking both about my dog who's in midlife and also other animal empaths who are listening. What would you say are proactive steps, maybe nutrition, movement, emotional presence, just anything that like I could be doing for him right now to make sure that I'm making this transition into his midlife the best it can be? I'm hoping so that means he has a more, more longevity and feels joyful and in better shape for longer.
Yeah. So, some of the ones that I would going back to like what's changing. So, for example, your metabolism slowing down. So just making sure that you're not overfeeding your dog.
Okay.
Love is treats, to dogs. And so making sure that all of a sudden your dog isn't, especially they are slowing down because of, they're getting less strength or they're just less playful. Making sure you don't get your dog too overweight. And the reason is in veterinary medicine, we really worry about that because the number one orthopedic issue, meaning the number one pain issue, and because it's joint related, is arthritis. And the number one thing that's going to aggravate that arthritis and make it worsen as dogs age is being overweight. And so, she should have said this, it's the number one issue in dogs and the number one issue in cats too. So it's a super important thing for people to know that your midlife dog and cat, most of them are going to have arthritis. The majority, like 80 to 90% of cats, and I think it's like, I don't want to say the exact percentage because I don't know it in dogs, but it's pretty darn high. So
Yeah.
really making sure that they stay trim is really
Right.
important for the mobility and their quality of life as they age. So
I'm
for sure
glad
that one.
I'm glad you mentioned the thing about cats because although I'm allergic, I did grow up with cats before we realized I was allergic. And cats are so nimble and agile. I think sometimes it's probably to your point with the whole predator prey piece. It's sometimes hard to tell because they're still prancing and pouncing around, that they're in pain. And I also feel like there's this odd cultural thing where we think a giant cat is cute. And it's not. It's not,
Yes.
but to your point, it's not because it's unhealthy.
Yeah. No, it's bad for their joints, which is what's one of the things I really care about. So, certainly doing that. And then thinking about, again, that as our pets are going from midlife into a senior, their ability to digest and absorb nutrients is decreasing and it's changing. So I love to feed my midlife dogs and cats, are especially foods that are very digestible, like, proteins from animal sources, feeding lots of good fiber, feeding diets that are high in omega-3 fatty acids or fish oils, that sort of thing. And then I supplement. I love supplements. I believe in supplements. And one of the top three I have for my midlife dogs are probiotics. So doing a probiotic, that's a dog or cat specific one. They have different gut flora than we do. So find something that is working for your animal. And I
Okay.
usually tell people, if it works or not.
Yeah.
Because the digestive tract is
Right.
obvious, right? When it malfunctions.
Yep. We're witness to it.
If the probiotic works, if it works for your dog or cat, feed that. Great. It's also good for the
Daily?
immune system. I would do daily
Daily.
for maintenance. Absolutely. Yep. And then I also like doing joint supplements that have a little bit of scientific evidence behind them. And the reason I say that, is because in animal medicine or in with the dogs and cats, supplements do not have to be regulated like they do in people.
Oh,
So supplement market can be a little bit crowded with things that may not have what is said in the bottle and in the bottle, right? It may not actually do what it says it does. They can make all kinds of wild claims that they can't even do with people. So parents have to be careful. And what we have evidence for is omega-3 fatty acids, so fish oils from marine sources, if you feel okay doing that. And there are things that are ethical and sustainable. So brands. So feeding omega-3 fatty acids, it's not only great for the joints, it's good for the skin, like the coat, like every allergic dog, like your
Probably
allergic
good for
dog should be.
for my dog's skin. Yeah.
Yes, your needs to be on fish oil. Like it
That's a good point.
definitely helps.
Okay.
Also, probiotics. I was talking about it for digestion, but the probiotics could be very beneficial for allergic dogs as well.
Oh, okay.
Because especially if you have a dog that has a little bit of an underlying food allergy, when they eat, if in their intestines or their where everything's absorbed in the belly, if you can make that barrier really tight and healthy and it's not inflamed, if you don't have inflammation, because inflammation is a leaky gut, right? But so if you feed things like a probiotic and if you feed things like fish oils, that's just really beneficial for our allergic dogs. So not even our aging dogs, but our allergic dogs. So even
Right.
2 reasons for you to feed those types of things.
So you were saying omegas, probiotics, and then what was the third one?
Muscle supplements.
Oh,
So
okay.
I am a huge proponent of feeding something called fortitropin.
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 Okay.
So what it is?
I was saying it
is-
again so I would remember.
I know.
I'm literally going on Amazon after
Yes.
this interview.
So there is a dog and cat version that they make for dogs and cats. It's been proven to be effective in building muscle associated with aging. So
Is it good for
one-
humans?
I think they do have a human version as well.
Okay.
So one of the reasons I got into my field of veterinary medicine was because when I was a baby vet, I was really sad to find that our senior dogs and cats, especially our senior dogs, were euthanized and their pet parents had to say goodbye to them because they were frail. They were too weak to get them around. Everything inside them was perfect. They were cancer free, didn't have Cushing's, like totally healthy. But
Yeah.
they had to say goodbye to their dog because they couldn't get up anymore. They were having trouble going up the stairs. They were frail. And so in order to prevent frailty in senior life and in middle age, you have to stay strong.
Yeah, that
And
makes
you
sense.
have to maintain muscle. Like so many benefits to maintaining muscle,
Right.
in people and in dogs. And no one knows to supplement for like muscle conditions. So I'm always like, please add fortitropin, which
Fortitropin.
you can find in. So I mean, it's easier to find Myos Pet, which is MYOS Pet. So Myos Pet makes it's a product that you can use as a food topper. So yeah, and I use it for my cat. My cat's a senior, and I have him on it.
I'm absolutely going to get these things. I was
I-
curious what with movement, is there like From what you were saying in the beginning of our chat today, my inner, kind of exercise enthusiast is thinking, okay, I need to like put a headband on my dog and get him lifting weights. And like, we got to go to the dog gym. Like how often do you think they should be doing certain types of movements, and what kind should they be like my dog, for instance, a big dog who's hitting midlife?
So I would say, I mean, every day they should be doing cardiovascular, work, which is doing like long walks or trots or running, building their cardiovascular system. And then from a strength training perspective, I like 3 times a week. So 10 or 15 minutes, 3 times a week, I show pet parents how to do their little dog circuit, the dog gym day is what I call it, right?
Yeah.
And they go to outside, they do like, all the things that I can, if anyone's interested, please visit my Instagram. Because if you want to see some of the stuff, I have it at my
I absolutely
Instagram.
am.
Yeah, it's not, it's Strut Animal, and it's Instagram and Facebook. And I have lots of examples of doing some exercises. But yeah, I would say 3 times a week, 10 to 15 minutes is a great way to like build that strength. And even if you didn't have any dog, equipment or knowledge of what to do, doing different types of things. Like, for example, your dog doesn't typically swim, but maybe they like to swim. So adding that activity in, doing things like standing on a stand-up paddleboard is a great full body strengthening exercise.
I know, imagine my dog doing that.
Yeah. So, there's things that people could do just by like being in their own environment that they could do to like build strength. And it gets your dog out of the house, and they just get so bored of like
Right.
same walk, same dog park. And, so it's great to like, yeah, I'd say a couple times a week if you can, and every day just really trying to build their cardiovascular endurance as well.
I like the reminder because I think one of the big differences, and this is even, I think, true for highly sensitive people and empaths, even though we can feel what our dog is feeling, it feels to me like during this midlife time, nothing feels like an alarm bell, if that makes sense, right? When they're younger, it's like they have so much energy and you're like, okay, we have to get them out of the house because otherwise they're going to destroy something. And whereas in the, much older years, it's, oh no, like we need to deal with all these issues that are popping up. But there's this sweet spot right now. And I'm saying this honestly, as someone who works and has kids, it's easy to kind of overlook it a little bit because he's good right now. He's healthy. He moves around, and he's not signaling, okay, I need to go out and play right now. But if we go out and play, he's super into it. So
Right.
you're giving me such a good reminder. And I think other people who are listening could probably relate, especially if they do have an animal that falls in this this stage of
Yeah.
life.
And you don't have to do anything crazy. You just have to modify some of the stuff, start with a nice, healthy, like diet, do the supplements that I recommended, probiotics, omega-3 fatty acid, fish oil, and then Myo's Pet. Like start those now.
Right.
Don't forget that like they are, almost going to be a senior in the next couple of years, but you can start those things now. And then when they become a senior, their senior years are more golden. So
Now, there's one supplement you didn't mention that we had tried with our dog in the past, and I'm wondering if the reason you're not mentioning it is because it's not conclusive. The
sure.
whole MSM, chondroitin, tart cherry, that whole thing.
Yeah, so MSN actually does have a little bit more evidence behind it, and also green lip mussel does as well. So it's a little bit easier to find, but the problem with those supplements is sometimes they're a little bit bitter, especially the green lipped mussel. And so sometimes it's easier to add an omega-3 fatty acid like a fish oil. But there is evidence for that as well. The least evidence that we have in dogs is the glucosamine and chondroitin.
Oh, okay.
We have more evidence for turmeric being beneficial for dogs with joint disease. But the problem with the
Really?
turmeric, you have to make it into a paste,
Oh,
and have such a high amount of it for it to be beneficial that the
right.
dogs. That's a problem with dogs and some of the supplements is we have to pick things that they'll take, and sometimes they like the things I picked. I know dogs and cats and I know that it's easy for a pet parent to give, and it's
Right.
easy to get. Versus getting turmeric, by the time you get the right levels and they're finding the right pace, like it gets very expensive and it's hard to deliver, and then your dog may not even eat it.
Right. So for anyone listening who maybe their dog is not just dog, their animals are currently in midlife, or maybe they're entering their senior years, or I just had a client who had to put their dog down because of an enlarged heart at the age of 8 last week, which was heartbreaking. And it was the right choice. Actually, I have two questions now, I'm realizing. Because one question I have is, from the work you've done and working with all these pet parents, if you have any guidance or advice on how to help someone enjoy this period without like leaning into the heartbreak too much. And for those who are trying to figure out when the right time is the right time, I feel like that's such a hard choice for people.
Yeah. So certainly, it's starting with the second is it's really, really difficult to know because a lot of it's individual based on the dog and the family. So you have certain families, for example, talking about dogs that are frail and slowing down. You have some people that as a family believe that once their dog can't, for example, go upstairs or get up by itself, that dog should be, that's their quality of life is not good anymore and they could say goodbye. But you have other people whose dog will become paralyzed and they'll be able to pick up their dog, and be okay expressing its bladder and helping it go to the bathroom and doing all kinds of different things. So quality of life, where I step in as a veterinarian, is when you have pain that you can't manage at all. So if you have a family that can't, again, their wishes don't align with their dog's current, lifestyle, but is very, very difficult to know. And again, just like we have those pain guidelines, we do have quality of life guidelines as well. And what I tell people to do is you need to also remove, especially for your emotional and empaths, you need to remove some of the emotion from it. So what you need to do, what I would suggest is starting to every day keep a journal of how your dog's doing. And then what'll happen is you could look back and you'd be like, okay, 3 months ago, we went on long walks. I didn't get any feeling that my dog was in pain. There wasn't any grimacing. And then this is not even aside from the normal things like vomiting, diarrhea, stomach upset, whatever, right? So like not even that stuff, but like that and that type of thing. Right. And then what'll happen is then 3 months later, you then have been keeping track. You have a journal. And you could look now and be like, gosh, like my dog grimaced all the time. He was very sick. Like he didn't like his.
How do you know they're grimacing? You've used grimace a lot. How do you know they're grimacing?
So basically what it is, it's a subtle pain sign. And it is a squinting of the eyes that dogs and cats get when they have a pain. And then the other thing that they'll do, and it's a squinting of the eyes. Sometimes what they'll do as well is they'll start to pant. So that'll be like a subtle pain sign as well. The other thing that they'll sometimes do, if it's not a squint, they'll open up their eyes really wide. But the grimace, that squint, it's a very common pain sign that they get. In dogs and kitties.
Okay.
And
maybe rabbits.
Maybe rabbits too. Maybe. But so that's some of the things that I say to try to do, because when you are someone who is empath, you saying goodbye to your animal is going to be harder than for other people.
I agree. I agree. Having gone through it.
Yes. And then thinking about your first question, some of that pre-grief, like the empaths, they're more at a risk for that. And that pre-grief is the fear and the knowledge that your pet you're going to have to say goodbye to your pet. And that gives you a huge sense of anxiety. Right. And so the other thing I want to say is that we now as veterinarians recognize that grief that people are getting, that pre-grief, and then the grief that people experience after loss of a pet is so intense, and sometimes even more than you would experience with like a family member you didn't necessarily see anymore. It's like losing it's very, very disruptive. And so, finding therapists and like seeking out your own mental health, like taking care of yourself, like doing self-care is so important for your empaths and for just anybody who's dealing with a senior dog, an aging dog, a dog that has a chronic disease. That's, it's really takes a lot of the person.
I couldn't agree more having gone through it. I remember the month leading up because, as you know, Cushing's can be, I
Yeah.
think we missed some of the signs at first because we had just had my daughter. So we were,
Yeah.
and then it was, wow, he's just gotten really thin. And then we got the diagnosis and we tried natural and then we tried the medication and the
Right.
medication almost seemed worse. Like it was like within a month, he went from fetching a stick in the lake to he was gone. And I remember very viscerally these sessions where, as a therapist, I'm sitting in these therapy sessions with my clients, trying so hard to focus, and my mind kept drifting to my dog. Like I was so overwhelmed. Sorry, guys, for anyone I met with during that month, but I was so overwhelmed with what you just called pre-grief. Sometimes I call it anticipatory grief, but pre-grief
Yeah.
sounds way better. But it just, yeah, like just knowing, I do agree. Empaths and highly sensitives, I think really can feel the grief even before something has happened because their ability to envision what it's going to be like is so vivid. Do you ever find, I found after losing him, there was this very acute time of really intense pain, but then this is just me because I think I allowed myself some of that pre-grief. I don't know if I had as prolonged
Yes.
of grief, if that makes
Yeah.
sense.
I think so. And I also think that sometimes when we, because typically we say goodbye to our dogs and cats as our choice, they usually don't
Right.
pass on their own, right? Which is also a very hard thing for pet parents to do. That's a very difficult thing. But, part of it is that if you've gotten to that point, when the animal does pass, you feel like they're at least some of their suffering. You've hopefully made that decision because you feel that there is suffering that we can't help
Right.
anymore. But someone that's at least relieved, and at least you can say like, I know that they're not suffering anymore. I know that the who they were as for their entire life as a dog or cat isn't what they were at the end, and we're helping them pass in a way that's very
Yeah.
peaceful and loving, and they could be surrounded. If only us humans could be. If I could be even so lucky, if I ever, when I do pass away, to be surrounded by loved ones and
Yeah.
holding, people, and not in something, as environment that's cold and sterile, but just surrounded by like, your loved
Right.
ones, your family.
Right. I almost
So
wonder too, because we know highly sensitive animals are a thing. And I don't know if you know that 30% of all animal species are highly sensitive. They
yeah.
actually started the research in animals, in bugs and
Oh, cool.
horses and different fish. And so there are ways to explore, and that might be something you might want to look into, and then we could chat
Yeah.
about it in the
No.
future.
Absolutely.
30%, so 30% of our dogs and our cats are also highly sensitive. My my loving dog now is a perfect kid dog because he's not highly sensitive. He's just go with the flow. He's just like whatever. My dog that I've talked about today, the one that had passed from Cushing's, was absolutely a highly
Hmm.
sensitive animal. Like one of those where if you're upset, he would come and put his chin on your leg and like he could feel your pain. Whereas now if I'm upset, my dog now just kind of looks at me like, "What's wrong with you?" And then I'll
Yeah.
walk away and like, "I'm gonna go eat and drink some water." But you talked about drive earlier. The dog that I had lost to Cushing's wouldn't pass. He would not pass. Like you could tell he was barely functioning. He
Yeah.
wouldn't pass. And so because I think we were all there and I feel like he didn't want to in a way. He didn't allow himself to because we were there. My husband put him in the car to bring him to the vet to have him get checked out, and he passed in the back seat on the way to the vet.
Yeah.
Like we didn't even have to put him down. It was like as soon as he was like, "Oh, okay. I don't
Yeah.
have to worry about all of you. I'm okay." And so I just wanted to also highlight the fact that some of our animals are also highly sensitive, and especially if they're drive animals like you were saying, I could see how if they're suffering, us holding on a lot and us kind of permeating that suffering everywhere instead of being there as a loving source for our animal could make it harder on them. I'm just being honest.
Well, I think they'll stay around exactly like you said. They'll stay around longer because of the bond with the person, and I have
Right.
seen that. I've had
Yeah.
dogs, and I have currently a few of my super senior patients, and dogs with a totally advanced cancer that they shouldn't be here, but they're here because they have such a strong connection with their person, and they choose to be here. Like, it's the soul bond that you have with your dog or your
Right.
cat. They've chosen to stay, and they're going to stay as long as they can, and hopefully they are reincarnated and come back to you in like a different time too.
Yeah.
And then actually I have a question. So I
Yeah.
always see back to the animal empaths, I see this all the time. It's a dog will hurt its knee, and the owner's like, oh wow, it's the same knee that I have. Or it'll be like, I'll try to explain, like, the French bulldog has a
Right.
compressed disc, and I'll be like, well, your dog has a compressed disc, and that's painful, and this is what that means. And they're like, oh, I know, I have the same disc. And I'm like, is it like your lumbar sacral? And he's like, yeah, lumbar sacral. So our animal empaths, and you may not know this, but like, do you see that they like have the same ailments? Did they like pick up their person's pain? Like, did they
I mean,
like,
I could absolutely see the validity in it going both ways. And it makes me think of a very simple example that's a human example, but I think it confirms what you're saying. Between my husband and I, we have an agreement, and this might sound heartless, but if he has a headache, I don't want to hear about it. Like, just go take care of yourself, drink some water, take some ibuprofen, tell me you need to take a break, go take care of yourself, do whatever you got to do. I love you, do it. But if he starts telling me about it, I will get a headache because because I'm
interesting.
so connected. I'm such a highly sensitive person, especially physically, that I could see there being something to that, and I don't know if it's just that I could see it very much from the human to the animal. Like, if they're aware that they're experiencing some sort of pain. But when I think about animal to human, the only part that I could see being valid based on science is that when you look at, there's some research about animals emulating some physical stature and movements of their humans.
Oh,
And
interesting.
I don't know. I wonder if their human is limping, if they limp, and then and then it aggravates their gait or their. That's super
Yeah.
interesting. I'm gonna dive into that more.
Yeah. Let me know what you find.
For sure. So, well, Dr. Kelley, you were so wonderful to talk to. I feel like I truly got some really great ideas.
Great.
Lenny will be very thankful. It's my dog's name. Is there anything that, you feel like you just really want folks out there to take away as like, this is what you can do? I know you said the supplements, but this is what you can do for yourself or for your dog, or just kind of, and it makes me think of something too, now that I want to redirect this question. For anyone who feels deeply empathic and feels like their life is more fulfilled and better when they have a loving pet or a pet to love, but they're afraid of the fact that this part of owning a pet can be really painful. I saw you take a deep breath and I said that. Is there anything you could say to those folks, to maybe allow them not to listen to this conversation and walk away only terrified, but
Right.
walk away feeling hopeful or empowered?
I feel that, our animals, it is really wonderful when they've chosen to like, spend their lives with us, and just like the joys, of course, of like having that dog or cat with you, and just, times of stress when you're stressed out or anxious, they come up and give you like, they always know, of course, like, even if they're not the empathetic ones, like they know,
Even if they're
like they
Lenny.
come, even they're Lenny, and he'll come up and he'll still like nuzzle you or snuggle with you. And I think it's just like, I don't know. I think that, having animals around, and, even though we have to say goodbye to them, even though they have shorter lives, like, and if we could just do as much as possible within our budget and within our capability and with our, whatever we can offer at that time of our life, and just make their life as good as possible. And like, just to like have a little bit of that like amazing bond, with our bunny or our dog or cat, like, gosh, like, it's, even though we have to say goodbye, like, to them eventually, or they have to age, like, that's so lovely to have them in our lives. And Even dogs and cats, and horses sometimes get their own pets too. You'll see it a lot. Like a bunny and a horse will be friends, and
Oh,
just like
yeah.
interspecies love is really
Yeah.
cool.
That's really cute. I didn't even think about that.
Yeah,
Well, I have so
but
many other things I could ask you, but I have loved our conversation. I really appreciate it. And if you ever want to get back together to talk about highly sensitive animals, feel free to reach
do it.
out.
I'll do some research.
Yeah, do some research, and I will certainly share all of your information so people can, bring their animals to the metaphoric gym. Um,
Yes.
and just as a reminder, if anyone wants to find you or find those workouts or examples, where should they look again?
So strut animal. So STRUT. So a happy dog or cat struts. So strut animal
Oh,
is my
cute.
website. Yeah. So on my website, I have pics of my top supplements, my top fish oil, my top, muscle supplement, dog exercise equipment. Like, please visit my website if you want to see videos of your dog and cat doing, or dogs mostly doing exercises. Cats are not as compliant.
I can imagine.
Yeah, visit Instagram or Facebook Strut Animal, and please, if anyone ever wants to reach out to me, please feel free to. I'm always happy to, answer questions when I can. So
Awesome. Well, thank you so much. I'll definitely be checking those
Amelia.
out. And I hope everyone enjoyed the episode and found something meaningful that they can bring back to their own loving pet or animal today. So be well, everyone.
Thank you, Amelia.